Hi, my name is Dr. Ravindra M Mehta, and I'm the founder director of Vaayu Chest and Sleep Specialists. And at the same time, we work in Apollo Hospitals as the head of Bangalore Pulmonology. Today, we're having an extremely interesting discussion because we're joined by some extremely intelligent, well read, experienced, and international global colleagues who have come down to Bangalore for a major training session and workshop, and we're taking advantage of their presence by looking at what's so important in 2026. Global respiratory health, global issues that it comes to entities like pollution, and the relationship of that to every part of healthcare, because we know that the lungs, if get into trouble, impact the whole body. I'm happy to be joined by Dr. Ashutosh Sachdeva, both a colleague and a friend, who is the head of intervention pulmonology at the University of Baltimore at Maryland. With me is my colleague and friend, Dr. Janaki, who also holds the title of associate professor at the University of Baltimore at Maryland. And my own colleague, Dr. Samir Bansal, who works with me in Apollo and heads Apollo Jayanagar, and holds many hats both in Apollo and in Vaayu. So we're very fortunate to have all of you. Welcome, ladies and gentlemen. So the idea is to make this fun and interesting. And 2026 has been a great year. We've started with Davos, where pollution was mentioned by Ms. Geeta Gopinath, who's very well known for her Harvard title as well as being in the World IMF. And we were all shocked when it came up to center stage in Davos, especially since we're talking changing roles in the global geopolitical scenario. And now we have a huge AI summit where we have AI leaders from all over the world. And currently, if there is 2 letters, a newborn should know when the kid says the first words, it's artificial intelligence. So this is what's going on right now. And here we have massive investments we talk about, and the statistics tell us that probably 1/4 to 1/5 of all investments in AI are coming into healthcare. So far, healthcare has been the classical doctor-patient relationship where you listen, you diagnose, you talk, you communicate, you plan, you reassure, you empathize, and then you execute a treatment plan. But now we're talking of so many tools coming in which are going to change the way we think, talk, patients interact, doctors work, and so on. And then, of course, we have that entity of the 20th of this decade, which we can never forget, called COVID. So there's an India pre-COVID and there's an India post-COVID. There's a global scenario pre-COVID and post-COVID, and that has brought about so many changes. So I think Ashutosh will agree that this has been in our lifetime. This 5 years have been like years we've never seen before. So what do you think? Where do you think we are in the global respiratory health scenario? You guys can see it right from your North American, castles, and and you see the changes happening at the pace we've never imagined before.
First of all, thanks for having me here, Ravi, and thanks to your team. And I'm not as erudite as you made it sound, but I'll dumb it down. I think globally the burden of respiratory disease is increasing. From the U.S. perspective, we have put a lot of effort, and my colleague Dr. Deepak did for the last 2 decades in educating the masses, in investing in the policy changes, getting tobacco restitution funds to impact nicotine health. And that has led to decrease in prevalence of lung diseases. Oh, importantly, the reduction in mortality of deaths from lung disease. And India or South Asia is kind of trailing back because there is no early diagnosis. So the prevalence of disease is low, but the age-adjusted death rate is double the rest of the world. So I think that's how we need to invest in is educating the masses, improving the access to people who need care for lung health and lung diseases. And you guys are doing a great job. It's amazing to visit Vaayu and what you have done in investing in your local community, your policemen, your firefighters, your politicians asking us to come by and understanding the impact of lung diseases is tremendous.
Great, sounds lovely. Now, Janki, when Ashutosh mentioned smoking, vaping, now, what do you think? So you do that? I didn't mention that I spoke the importance of smoking and so on, and I'm adding vaping to it and so and more. India has been very unusual because we have a menu card of this, as you well know from your original medical college days. We have cigarettes, we have BDs, we have so many other things over there. And of course, we're not including gutkhas and all, which are still very much there. Where do you think we stand with that? And what do you think is the relationship of that with respiratory disease? And of course, we'll open that juggernaut of pollution later. But where do you see that? And how do you think differences exist across the globe and so on?
So India actually, even though if you look at any of the Indian websites about smoking, they say that tobacco use is not as much, but we are the second largest consumers of cigarettes. And even though it
You in India?
in India, yeah. Because of the fact that a lot of it is done, but it is not surveyed, it's not captured. So the problem is the smoking problem is there. And then, of course, there are diseases like COPD, worsening asthma, and everything. And even though vaping is banned in India, it's not really banned because it is definitely available. Electronic City, I went shopping, and there it was, I Smoke Shop right there, and selling big cigarettes right there. And we went to Goa and we saw quite a bit of stuff in there too. And in fact, today in Kambagada airport, I smelled marijuana. That's not where I was expecting to smell marijuana. So not only it is smoking, it's vaping, it's inhaling all these things around us. And I think as India's economy is booming, there are different things because cigarettes have always been, they have a stigma to it. So people don't like to be seen with cigarettes anymore. So I think the newer devices are attracting the youth. And unfortunately for us, they are much more sexy than telling, let's get pulmonary help for COPD. They like all these lovely USB kind of devices, and it is being dumped in the Indian market. So
Tomorrow there will be a major workshop for us in educating providers. So, the Indian providers, doctors, chest physicians, and we're getting all of those tomorrow are not very savvy with all this. So I think this will be a major eye-opener for all of us. Shift to Samir. Samir is as Indian grown as can be. Samir, we have seen major changes out here. We started off as, fast. If you see a 50-year panorama, we were called TB doctors. Nobody wanted to take up the specialty of respiratory medicine. And now, fast forward, we're talking India as being the global hub of, we wanted to be AI, but we are currently asthma, this chronic bronchitis, emphysema called COPD, things like lung cancer. So what is your perspective on the Indian scenario? You've seen the whole transformation, and what can you tell us more about it?
So absolutely, it's been quite fascinating, in fact. But from the very fact that, okay, we are currently the largest young population, as well as, we have a huge population, aging population. So there's a mix of all kinds of, population that we have right now. And we are seeing there is an increase in the number of infections overall, especially post-COVID. Over the last 2 years, we have seen rise in respiratory infection, people who are coughing and, chronic cough not going off, lung cancers. And in fact, if studies from China and certain geographical locations in India are to be, up to 40% of lung cancers that we also see are amongst non-smokers. So yes, smoking is a big challenge, but at the same time, other situations, other problems such as pollution or maybe multiple other things, in fact, rising, the Indians make for the highest number of travelers also. In fact, I was reading this thing. Southeast Asia has had an increase in air travel by almost 100% from 2005 till 2025. So all these factors, a mixing population, high population, increase in population or other increased infections, climate change, worsening pollution, more mixing up of all these people. So that is where the challenge is. And we are seeing all the conditions. COPDs and asthma, we are the largest. Diabetes, yes, we were the capital. COPD, we are the capital. So when the denominator is so high, we are also seeing mortality. So it is as high as, maybe pneumonia with COPD.
And that's correct. So I think what we've seen now clearly, and see, technology is added to it. So now we've seen, I think anybody who has a lung has cuffed in this winter. Absolutely. And we have no idea what's going on, whether it's a whole bunch of new viruses, it's these allergens, something in the environment is turning us. But these new technology tests which we've done, and they are available with us over here, are showing much more asthma than we ever imagined. So that 5 to 10% of the Indian population, and now that we look at a 1.6 billion denominator and we talk 5 to 10%, looking at massive, massive numbers. So in short, I think we are in the decade of escalating exponentially, if not horrendously, respiratory disease. And you mentioned asthma, bronchitis, COPD, lung cancer, lung fibrosis, and so on. So this has been a major thing for us, to the point that I think in this winter, very few people are taken off in the healthcare point, and they themselves have fallen sick. So provider falling sick is giving the patient not a lot of confidence, and we don't know what to do in all these areas. So a problem certainly. But one more thing I want to now talk about. Traditionally, we talk of the fact that we give medication. So the old model is come to doctor, he looks at you, give medications, take a fix and go away. But now things are changed. Now we're looking at chronic disease. Some chapters are not going to close. Some stories will go on. It's a long journey. So in chronic disease, Dr. Janaki, you are from the West, and the West is known for putting in interdisciplinary, multidisciplinary, comprehensive models. Do you think it's time to raise a clarion call for the fact that treatment is beyond pure medicines? And I'll add one line to it. It's actually pushed by Big Pharma. Big Pharma comes with $1 billion drug. Big Ahead comes out. If you look at today, they're talking of obesity is not a disease. The obesity drugs are now the latest fad. It's like AI. And so they're being sold left, right, and center. Some of them have gone off patent. But wherever we see that people look at a fixed medication, we did that in the OPD today, we had a problem. So do you want to open this concept of value-added chain of healthcare and not only pharmacology or medicine-based?
Absolutely. I think that it's very important for us to not only think about preventive medicine, but quality of life for the patient, right? Because and also to inform patients on what's happening. For example, in COPD, right, the mainstay of therapy for COPD is, yes, you give bronchodilators, but that is going to help only up to a certain point. But then you have to do things like pulmonary rehab. You have to make sure that they have a proper diet. And this has been actually studied in rural India. There have been some cool studies where they have done with community health workers intense work with these patients to get them just a single session and then taken it to their homes. So you just talked about AI here in the biggest boom, and this is Electronic City. This is the home of all computing for the world. There is no reason why some of this AI cannot be leveraged to doing what we call as telepulmonary rehab and things like that, and make it available for people. And I think Vaayu is doing such a phenomenal work. I met your physiotherapist there, and they were talking about how they do telepulmonary rehab, and that's wonderful. And then also the diet, right? We've got to think about diet, right? And we do not need nutritional supplements. Nutritional supplements, like people say I'm taking 500 milligrams of turmeric. That scares me because then your liver is going to be shot and it'll die. But people need to be educated on what's happening and also eat things which are really helpful, right? Unfortunately, we love carbohydrates. I have not seen any part of India which does not like carbohydrates. And in the COPD patient, if you keep eating carbohydrates, you're producing carbon dioxide. And then you can't get rid of that carbon dioxide. And that's a problem. We have very clear things like ragi, curd, leafy vegetables, millets. We used to think millets is only for the people who are working in the farm. That's not true. Bring the millets home. Don't let it cost so expensive. Make things with millets. And I think that's where we need to go. Because when you give people bronchodilator therapy, all you're doing is opening up their lungs. But if you try to give them things like pulmonary rehab and diet and taking care of a holistic manner and teaching them. My personal experience is I had tried to tell my mom not to be exposed to mold. There was a lot of mold in our house. I kept on talking to my parents. She didn't listen to me. In a matter of 6 months, she developed end-stage fibrotic lung disease. And she survived for 5 years, but it was really difficult to raise her birthday. It was really difficult because she was on 10 liters nasal cannula oxygen when she died.
Maybe that's why we became a pulmonologist.
Yeah.
Okay. So we sense thanks, Dr. Janaki. Samit, to put it, you sense this, you lived this journey from being a strong intensive care intervention pulmonary doctor to trying to put this end-to-end models. Do you want us to tell us practical examples?
No, absolutely. I think one of the biggest things that people don't realize, or rather it's out there, is that these are all called lifestyle diseases for a reason. And therefore, medications, yes, they can work for infection, they can work for just that acute part of it. But again, they can't really reverse the disease or rather improve your quality of life. And we have too many examples. We have, patients who struggle to breathe, and they have been put on medication after medication. They come to us for help. What is there beyond medications? And they do 2 or 3 months of rehabilitation. In the sense, as early as 2 or 3 months of rehabilitation, the life changes. I'm not saying maybe for everyone, but we are saying for majority of people, it makes a difference. They can walk better. They get less breathless. They can, in some cases, the oxygen requirement that they are on also reduces, and it definitely reduces their hospitalization. And we have many, many examples of that. Apart from that, multiple other things, taking care of your diet, taking care of all the other comorbid condition that you have, maybe the sleep, which is an important part because people don't realize, when you have a good sleep, you give your body time to heal. And most of these people struggle to sleep. So when you take care of your sleep, when you take care of your exercise, when you take care of your diet, and when you get, maybe prevent infections with vaccines, all the preventable causes, I think you are doing 80 or 90% of the job which the medicines can never read.
So I find that fascinating. You go in the morning, you're going into the hospital, you walk into ICUs, you take care of sick people, you send them out, and before that it used to be you don't know what's happening. Now you bring them and you say, wait, let's slow down. Besides medicines, let's do this exercise slash what's called rehabilitation. You give an avenue, you get a nutritionist to them, you get a psychologist to them. Sometimes they can be quite depressed, and you see dramatic change. I think this happened after COVID. And after COVID, I think this is worth talking about. We saw people who were sitting in their shells. We went into our shells like a turtle to survive the onslaught of COVID. COVID came into a house sometimes and took a good deal of their daily away. But those who came by were left in shambles. It's very reminiscent of what you see Gaza left in shambles. So this was like a healthcare shambles, an entity. And after that, it pained us a lot. And then we realized it took us that shock to realize medicines is not going to solve it. End-to-end therapy. So we're introducing what the rest of the world talks in tech, talks in retail, talks in supply chains, the value chain of healthcare, which is required. And we have our colleagues from abroad who have actually done it so well, and we're trying to do it in our setups. Thanks. This opens up a very new, interesting window. Now let's talk fun stuff. Practice has changed, Ashutosh. We basically have now patients sitting with this, and thanks to these Claudes and Geminis and Chat GPTs, doctors barely stop cribbing about Google in patients, and now we had a higher level of engagement. What is the US perspective? How do you deal with all that? Is it beneficial, detrimental?
So AI is around us, and our WAP AI is around us, right? So we are surrounded by it, and it has a lot of good value. We have been seeing that for decades. I think it's getting attention because there is a lot of investment in generative AI, and that is what is both a good thing and probably a challenging chaos where we need to have some governance, some rules, some defining of the extent to which how you use. I think patients are going to be using a very simple chat GPT model or any type of other open AI model to understand, do their symptoms really mean something scary? Like, do I have a cancer? Or what should I do? And that's what the patients are trying to do. But we can leverage that to provide have it function as a life coach. And that has to be validated, but that's where the true value is. If I have depression and I need a coach who can help me, it's a double-edged sword because a chat GPT or an OpenAI model could lead you into a wrong direction. At the same time, it could get you out up in the right direction to the right resources.
Interesting. Samir, last 2 days ago, had a CT scan, the reported as fibrosis. The patient took we just put into chat GPT, came back yesterday and says that genetics is no fibrosis. What's your take on the Regency area right now?
And I think one of the things is because as Dr. Ashutosh mentioned, because there's so many models at this point of time, and because there are certain models which are trained in a specific way, but a lot of people don't really know that. Yes, at one point it is good for patients maybe in some resource limited areas, if they have access to all this, to at least get an initial consult, maybe to some extent. But again, it is going to be challenging. There is some governance absolutely which is required for all this, and a word of caution for all the people also who use it.
Right. So it's fascinating now, and the modern doctor will have to deal with the fact that you're talking to a patient plus AI. So it's a patient plus and on the, and so on. So interesting. So we've talked of the, yes, Ashutosh.
Yeah, so I think what patients bring to you is fascinating. Those are ideas, innovation, right? So 10 years ago, patients used to come and ask us, when you biopsy it, can you actually just take care of it? And they actually make surgery, and I had to explain to them I'm not a surgeon. But then, after a couple of patients asked me, the next thing that struck me was, oh, what they're asking is, can you ablate them? And fast forward, we are at that point where we can ablate things which are smaller nodules safely. Now we need to see where this peel goes and how it competes with the standard.
So I think you can also say that the knowledge gap, so it's very fascinating. 40 years ago, the physician of yore used to read one book and that cook to still up 25 to 30 years. He would augment it by experience. He was respected, there was authority, and that was the combination for healthcare, the highly paternalistic, respectful model. Fast forward 40 years, you have everything is verified now. So whatever you say is verified. Not only is your word verified, your tests are verified. Not only that, everything is put together in the model and your entire advice is verified. So I think now we have to deal with patients plus AI and then deal with what has to be done after that. So our patient contact, our way of dealing, it requires a transformation. What do you guys say?
You have to verify the AI. And so maybe what you just said, you put a CT image and what is the level of fibrosis? I think that's the next in thing. Or what is the severity of COPD?
Yeah.
Do you have a phenotyping that we can predict? Interestingly, one of our, good friends, young, I would say not child anymore, an adult who's graduating from college actually got funded for exactly the same pitch. How do you correct AI? How do you find errors in AI? And he has a $500 million.
You barely have developed and you're looking fellows in the. Okay, so we can't have five, core respiratory and critical care doctors in a room and not talk pollution. So in 2 minutes, we'll talk pollution. It's the elephant in the room, the monster on earth, so the craziness, and just a quick 30-second background. Delhi hits AQIs of 400 to 600. Today is still 250. And you landed in Ashutosh, Delhi. We're still happy to see you healthy and helping us here. Bangalore is going up. Mumbai hits 250 all the time. Janaki is from Mumbai originally, and so am I. Short lines on pollution and where do you see this is going, Dr. Janaki?
So pollution right now in India is astronomical. So I remember coming to India and not being so breathless. The minute I landed in Campagora airport today and I came outside, I couldn't breathe and I lost my voice. So it's many different things contributing to this pollution, right? Look at our the reliance on thermal power, right? And the entire Indo-Gangetic plain there, it's not only air pollution and what we talk about particle, PM 2.5 and PM 10s, which are tiny particles which can go deep into your lungs and cause a whole bunch of lung disease. But it's also burning of different things, the agricultural burning, and we are the world's highest sulfur dioxide producer.
So now we cooked. Now what do we do?
So what we do is we really have to we look at buildings and new buildings being planned. We need to start having green buildings, right? Rooftops with green buildings. Like I heard that the Infosys campus is using solar power to light all their lightings and everything inside. So we have to really start thinking creatively on how do we use our energy and where is our energy coming from. There has been a real shift in India also where they're moving away from thermal power to using more of nuclear power and hydraulics power. But there has to be a more investment in clean air. And then you're having all these buildings, you're having all the traffic. I think things like, building up our transit systems that...
What do you think that is? So this is contributing to the high respiratory disease that the respiratory kings of the world because of pollution.
100.
As it not able.
Absolutely. Actually, PM 2.5 increases the risk of COPD by about 30%. every 10 microgram increase in PM2.5 actually increases the risk of death from lung cancer by 15 to 27%. So PM2.5 contributes to a lot of diseases, which include COPD, worsens asthma, causes prenatal morbidity and mortality, causes diabetes, can cause stroke. I think I've said enough on this.
So pollution, something any final words on pollution? We live, breathe, exist, treat, suffer, all of it together.
I think what India is going through, or rather was going through, was a lot of rapid industrialization and development. But in the process, what we forgot was the sustainable development. And that is where the problem started, because so far we have ignored this. We said, chalta hai, which has been the attitude, but we are seeing the impact of it now. More and more people are developing, adult onset asthma, which we never really saw earlier. More and more people are getting diagnosed with lung cancers and so many other respiratory diseases, which Dr. Janaki also covered. So yes, it's time to wake up to this, time to accept that there is a problem, and time to act upon it.
So booming India is also suffocating India. We have chronic disease going on. We used to say in the past what cannot be cured must be endured. Now we're trying to say what cannot be cured, we should be empowering people to try and make a difference. Lovely points to dwell on and lovely messages to take home. So thank you very much, all of you. And this has been an amazing discussion. Lot of insights, lots of interesting points. And hopefully 2026 is both the year of interest development and generative transformation, not only from technology, but from healthcare. Okay, so respiratory disease, booming India, problematic India, suffocating India. Let's do rapid fire round with our experts here to understand what they can say using the experience and the first thing which hits their head. So as we have an AI summit going on there, depending on the highest level of natural intelligence garnered by these amazing folks to tell us which way to take ahead. Dr. Ashutosh, the biggest change in respiratory medicine in the last decade?
I would say increase awareness of that we as pulmonologists exist, that there is respiratory diseases that need attention. So it's interlinked to multiple diseases that we cater for.
That. Dr. Janaki, the most important challenge facing us in respiratory disease and overall healthcare globally.
Getting patients to understand that a lot of years of information cannot be just held out by looking at a Google search. So trying to build that patient, this relationship, and garnering generative AI in a correct fashion to talk to our patients and help them get to the next step.
Dr. Sabir, we push you, you're a Delhi guy, we push you from Bangalore, we put you into Lutyens in Delhi where you are sitting in the highest power circus. What sweeping changes will you make for fixing this pollution problem?
Oh, and there's a lot which can be done. So I would do, the first thing I would rather do is, make certain policies, especially at the industry level, phase out all the vehicles, especially the commercial vehicles, which have been planning, because in India we see, vehicles running endlessly, diesel vehicles especially, and slowly transitioning to maybe electric vehicles or other, other forms of sustainable energy. And similarly for all the other industries, same thing. And the crop burning, will take an action on that, and certain indoor pollution. So these are few things to begin with that I would like.
Certainly in 6 months you'll be taken off your seat. This is the head of flip. Whatever come regular. Dr. Ashutosh, step. No one likes us. No one likes doctors. I tell people you don't want to meet us. A single best advice of prevention for all patients with to prevent chronic or any respiratory disease for that matter.
I think Samira, we will talk about this. People forget that nutrition, which is diet, how you focus on that. Exercise, which is interlinked to our, ingrained in our societal culture, but we don't follow that. And then sleep, which is heavily ignored.
And move out of a city with pollution.
Well, if you can, that's probably an option.
Great. And Dr. Janaki, it's all about families, right? And you're one of those who espouse that so strongly. A single best advice for family members. Again, a quick 30-second. So many books are coming out that if I see that my father's going to get disease, I should change my lifestyle. We don't see that penetration. So rapid fire, your single best advice for family members or patients with chronic respiratory disease.
So whatever things they were exposed to, like smoking, things around you, incense, mosquito coil, air fresheners, everything, mold, whatever caused that, you're living in a polluted area, try to make sure that you are not doing those things which are contributing. We are living in a polluted area. We are trying to do policy change, but we also have to look at our homes and make sure that our homes are safe and what we are inhaling in our homes also matter.
Great. Samir, before you leave us, AI and respiratory disease patient perspective. You just talked about that.
So I think yes, it's possibly a good tool. You know, patients can initially use AI to screen what their symptoms are and possibly just see, especially when they're not able to find an appointment. But yes, using AI to treat themselves is something which I would strongly caution against, because AI, while it can be useful, it is not 100% right. So always use it with caution, and maybe a great screening tool.
I will add one line to it. Last patient told me yesterday, looked at, Jabri looked up and said, Doc, are you sure? Then me. So Dr. Ashutosh, AI and respiratory disease, doctor perspective.
I think that this is a very exciting time for us. We are able to now capture patients who have chronic lung disease like COPD and get to the level of phenotyping them radiographically. We are able to identify lung nodules and risk stratify them in a unique way compared to just population statistics. I think this is an exciting time where we probably going to move fast forward into large data sets that can give different predictive algorithms on who is at risk and when are they at risk and what type of treatment might work.
Lovely. To conclude, Dr. Janaki run a formidable lung cancer detection clinic in the US, lung cancer screening and prevention. Your best advice to the common person.
The common person in India needs to be aware that lung cancer in India is a non-smoker's disease. So whatever you're inhaling is definitely likely to cause lung cancer. And lung cancer is non-symptomatic. So if your doctor advises X-ray and you see a nodule, make sure you follow it. It is not because somebody wants to make money. They really care about your health. It is very important to make sure that you prevent it. But if you can't prevent it, if somebody finds something, act on it early. Don't procrastinate. Don't only listen to AI. Listen to your doctor.
Perfect. And Ravi, the mention of the chest X-ray, we can now use chest X-ray and combine generative AI, machine learning, and convoluted neural networks to enhance detection of pulmonologists.
Perfect. Thank you so much. So that ends the rapid fire round. To continuing message, respiratory disease all-time high. Chronic respiratory disease is here to stay. It is not only a fix, it requires a lifestyle change. Good systems are required. It's a shared relationship between the person for prevention, the patient when you get disease, and the healthcare system in a very comprehensive value-based model and not a medication-based model. Screening and prevention is very important to have good quality of life and longevity. And ventures which come out of either policy and things like pollution prevention are going to go a long way. And we at Vaayu also are doing a bit by doing this occupational and cancer screening for large populations. We finished 10,000 people. So many such ventures are required so as to make a difference. Thank you very much. Continue the lovely job, guys, you do, impacting millions of lives. And I conclude this session.